complicated. On the other side, this is the against people. Their campaign has also started, and so our media are enjoying themselves playing with the two sides, as they do. And they're claiming that this scheme is going to create huge environmental damage, which is a very emotive thing to say in a campaign. That it's going to be more dependent on London. And I know in UAE you have these different centres, so I think you may understand a little bit of how that feels, where one centre starts to be more important than the others, or seem to be in the media and in international eyes. In the UK, London is everything. When you travel abroad, everyone says, oh, you live in London? No, a long way from London. Oh, Manchester? No, not Manchester either. Those are the only places people seem to, thanks to Manchester United, I guess, have heard of. Maybe Liverpool sometimes. But people don't like the fact that London is the centre of everything, and this rail link is going to make that even more important. And also they say that it's going to crowd out the spending that other transport initiatives need. And that, I think, is likely because it's going to be so expensive by the time they finish buying all those houses. But having said all of this, you know, the feeling is that the government has done really well so far, because the number of people they've spoken to, those figures of the people who actually have complained and had tunnels added to the plan, cuttings added to the plan, this is a good sign. This means that people really are taking notice, they are joining in with the campaign, and they're influencing the way the campaign develops. So that's a sign of success. But I can't go to the end yet, because that's not until 2017, at least. So I'll move to a campaign which has started and is well underway, actually. This campaign started in 2008. And this is the Eat Well, Move More, and Live Longer campaign, the Change for Life campaign. And this was started, as I said, in 2008, actually by the last government, based on childhood obesity. In the UK, children 30% of children are overweight. 61% of adults are overweight. So it's a bad situation. It's actually costing the country a huge amount of money, diabetes and other illnesses. But also, it's impeding people's life enjoyment, because weight is such a major problem now. And what they wanted to do was to avoid what they call the conveyor belt to adulthood, that young people start eating heavily where their parents are feeding them the same that they're eating, I suppose, and everyone's starting to get overweight, and it's a conveyor belt that is pretty unremitting. So they wanted to build physical exercise into people's daily lives. And for this, they are using social marketing or public relations. Social marketing is a new term in the UK because public relations doesn't have a very good reputation, which is sounds ridiculous. It's like we say that the cobbler's children run barefoot. So public relations hasn't done a very good job for itself. But social marketing is the term that's used now. And they spent £75 million over 3 years, in the first 3 years of this campaign. And it was the fastest building government campaign that's ever been. So it was enormously successful. Trust had to be established, as we've heard a lot since we've been here at the conference, and trust is really important. You need to build trust in order you need to build relationships before you can actually talk to people, especially about their eating habits and so on, and about important health issues, to encourage people to trust you so that they're going to take what you're saying on board. And actually, commercial marketing can tell people to eat all sorts of the wrong things, and the crowd want to follow. In fact, I can remember when my children were quite small, I invented a rule that they couldn't have anything that they'd seen on an advertisement, because it was a lot of money and they're pestering you all the time in the supermarket, as many of you will know. So that was the rule, and they would ask for things, and I'd say, did you see that on an advertisement? No, we had it at a friend's house. And of course, if we bought it and tried it, you knew they didn't, because their faces were so disappointed, because there was nothing like they thought the advert would proclaimed. So social marketing and PR often have to go against this commercial marketing force to get people to step out of the crowd and do something different and look after themselves, in the interests of their children as well. And children were first, because it's clear that the better they start, the better they're going to end up. And this was the campaign philosophy right from the beginning, to get people to understand that. the people in the country clearly needed to be concerned about their children's weight. This sounds silly, but very often if you're overweight yourself, there's no problem. You see your child getting overweight. Sometimes it looks like child abuse to me when you see these enormously overweight children. But they need to recognize that the responsibility is theirs. It's nobody else's. It's not the government's. It's not the healthcare workers. It's their responsibility. They need to know what they've got to do. They need to know it's possible to do it. These are all elements of the campaign. They've got to be allowed to experiment. You know, in public relations, if you want someone to change their mind, they have to have an opportunity to experiment with a new idea, to try it. This is why we do roadshows and conferences and so on, to get people to think about the idea more. And then they've got to embed the new behavior into their daily habits. Lots of supporters, obviously, were brought in. 800 at the launch, but over 25,000 by the end of the first year. Health workers and educators and other people had joined in the campaign to help it to succeed. 7 commercial organizations and NGOs at the beginning. Big names like PepsiCo, Kellogg's, Tesco's supermarket, Asda supermarket. They were all joining in the campaign at the beginning. But by the end of the first year, 183 major organizations had joined in. This is really important because then you've got a huge number of other people saying the same message and supporting what you're doing. They won't join in unless it's looking good, mind you. Unless the people are taking notice of it, they'll just ignore it. So it's a very big point in their favour. And the Advertising Association agreed to give £200 million of value to the campaign in free advertisements over the first 4 years. Partners, as I've just pointed out, are really important. They're chosen for their closeness to the public so that they know that the public will be influenced by them. And supermarkets are very close to the public. We buy our food there, so we trust them. And so you can build on that trust by partnering with supermarkets, as banking has done. A lot of banks now work from supermarkets. Supermarkets have become banks because they're building on that very trust that they know exists between the people and the supermarket. So stands were set up in all the major supermarkets. And they were hitting close and hard. Close through the supermarkets, but also through language. This is a poster in Gujarati. We have a lot of people speaking different languages in the UK, so they have to be spoken to in their own language, in their own way, and powerfully. If you were at Arwen's presentation yesterday, I was longing for someone to say death as one of the words to do with the rats and the devastation, but they didn't. Death is a very powerful word, especially when it's next to a picture of a very nice boy. And they're trying to get them to stop doing nothing. In other words, stop sitting in front of the computer games and do some exercise. This is a complicated chart, but what it shows you in the evaluation is that actually it scored really highly, the campaign. It was trusted, it was accessible, it didn't judge people, and people responded very well in the interviews, in the evaluation afterwards. So that was why it was succeeding and why the partners wanted to join in with it, because that is part of the important aspect. After 2 months, there had been 1,317 articles written in the news media and on broadcast media, 95% of which were positive. If you go back to the campaign earlier, the rail campaign, that isn't the case with that. There were a lot of negative articles. But in this case, most people were positive towards it, and that's why it built momentum. And Asda, major supermarket, had sold 70,000 bikes at cost price, which is a deal that they did. So they made no profit out of those. And bicycles were one of the things they were trying to get kids to get hold of so they could do more exercise. And actually, when you were working in the UK at that time, you could have something cut out of your payroll to save up for a bicycle. So your employer could deduct money from your payroll to save for bicycles for your family. So that you could do more exercise. So the government involved the tax system. You actually had a tax reduction if you bought a bicycle. I think there are probably a lot of them still sitting in the front hall. But anyway, they got their bicycles to do exercise. So people were convinced to help their children to reduce sugar, reduce snacks, and reduce the time spent in sedentary inactivity, sitting in front of the television. They wanted them to do 60 minutes of exercise a day, which is a lot, but a youngster needs to start off doing a lot of exercise to be healthy. And this thing, the snack swapper, over 2.5 million were produced, and they ran out. This was something a child could have, and they could turn the wheel and find something as an alternative to the snack they wanted to eat. So the snack would be one side, and on the other side it would say something healthy that they could eat. And they became a must-have item through Facebook, online, and everywhere. People were trying to get hold of these things once they ran out, which is pretty amazing, and it showed us a huge success in the campaign. And here's some more of the evaluation. They set out to get 99% people to do at least one of these things, which they achieved. But they set out for 77% to do 4, and 83% did at least 4 of the 8 targets. And all 8, they thought maybe 16% would do it, but 20%. That doesn't sound much in real terms, only 4% difference. But that's 180,000 families that 4% represents that agreed to do all 8 of the targets to improve their health. In value for money terms, they actually added an awful lot to the government original spend. So people pledged more money, and at not least over nearly 300 million in advertising and sponsorship. The Simpsons cartoon was sponsoring the campaign as well, so they did a storyline on it. In the analysis, they did a huge number of different ways of looking at it. And as Jerry was saying, you need really careful analytical tools. And I don't know, you'll have loyalty cards when you go shopping at the supermarket. And they can test, obviously they know a lot about you. And they did the club cards through Tesco's and other loyalty cards to find out if people's shopping really did change, to discover that it had done. The most effective element of the campaign was the mail drop. It cost 88